Welcome to today's lectures on common non-infectious disease of dog. This lecture is part of the principle of animal health care and disease. Today we'll be focusing on some of the most common non-infectious disease affecting our companion animals, specifically for dogs. We're going to cover a few non-infectious disease for dogs. By the end of this section, you are able to describe the common non-infectious disease affecting dogs, relate the cause of this disease to the clinical symptoms, understand the diagnosis and treatment options available for this disease. These outcomes will help you to understand not only how to identify these conditions, but also how to manage and prevent them in the clinical practice. Let's start with an overview. Non-infectious disease in dogs are often linked to lifestyle, genetics, and age. These are conditions that are not caused by infectious agents like bacteria or virus, but rather arise from within the body or due to external factors like diet and exercise. In this video, we will cover three non-infectious diseases: obesity, cardiac disease, and osteoarthritis. These conditions are increasingly prevalent, especially in pets that live sedentary lifestyle or have poor dietary habits. Let's look at obesity, which is a growing concern for many pet owners. Obesity occurs when a dog consumes more calories than it expends, leading to excessive weight gain. The consequence of obesity can be severe, affecting a dog's joint, heart, and metabolic system. The causes include overfeeding, lack of exercise, desexing, and sometimes underlying metabolic disease. Desexing, while beneficial in many ways, can reduce the metabolic rate of the dog, and client education is key to managing this. Diagnosing obesity is straightforward. It involves a physical examination and some case blood work to rule out other metabolic conditions. The consequences, however, are quite significant. Obesity can lead to joint disease like arthritis, cardiovascular disease, diabetes, and even pancreatitis. Managing this condition early is crucial to prevent these serious complications. The treatment of obesity revolves around diet management and increasing physical activities. Prescription diet like the Hill's R&D or Royal Canine Society are designed to help pets lose weight safely. Additionally, replace the treat with low-calorie alternatives like vegetables or fruits, and encouraging regular exercise are important components of a weight loss plan. Proper client education on diet and lifestyle change is essential to long-term success. Let's discuss cardiac disease, which refers to any condition affecting the heart ability to pump blood effectively. Heart disease can lead to congestive heart failure, CHF. Some heart conditions are congenital, meaning dogs are born with them, while others can develop later in life due to factors like obesity or age. For example, small breeds like Maltese are prone to mitral valve disease, while large breeds like boxers are more likely to develop dilated cardiomyopathy, DCM. The clinical signs of cardiac disease can vary depending on the severity. Common signs include coughing, panting, exercise intolerance, and an increased resting respiratory rate. In most severe cases, dog may exhibit symptoms such as ascites, fluid buildup in the abdomen, cyanotic mucous membrane, which is bluish discoloration due to lack of oxygen, and even collapse. Early recognition of these symptoms is important for managing the disease. Diagnosing cardiac disease involves a combination of physical exams, blood tests, and specialized diagnostics. These may include an electrocardiogram (ECG), chest radiographs, and a cardio ultrasound. Advanced testing, such as cardiac pro-BNP, can also help detect heart failure. Monitoring these markers helps to track the progression of the disease and guide treatment decisions by the vet. Treatment options for cardiac disease depend on the stage of the conditions. In early case, vet may recommend regular monitoring without medication. As the disease progresses, medications like vetmedin and Forteco may be prescribed to support heart function. Diet also play a crucial role. Prescription diet with amino acid like L-carnitine and taurine can benefit the heart, and restricting sodium can reduce the heart workload. The prognosis is good with close monitoring and treatment for cardiac disease. However, cardiac disease can be a chronic illness which tends to worsen with time with no monitoring and treatment, and many will die from congestive heart failure, which is the end stage. Our final disease in this video is osteoarthritis, also known as degenerative joint disease. This is a chronic condition where the protective cartilage in a dog joint breaks down, causing instability and inflammation which lead to pain. This is very common in older dogs, large breed, or dogs with a history of osteopathic issue, such as ruptured cruciate ligament or medially luxative palate. This is a diagram to highlight specific arthritic changes. We will start from the left, which you can see that there's erosion of joint articular cartilage. And then with further erosion, you can see on the center one that there is a bone spur. We call it osteophyte, right at the margin of the articular. And it becomes more obvious as the disease progresses to the most right-hand side of the picture. Osteoarthritis have a few predisposing factors. Of course, the main one could be the obesity or genetics, such as from GSD or golden retrievers, as mentioned about previous osteopathic conditions, the age of the dog, exercise, and even diet. Dogs with osteoarthritis often exhibit lameness, reluctance to exercise, and change in their gait. The condition is diagnosed through physical exams like lameness exams and joint radiographs. Long-term management requires careful monitoring, especially if the dog is on medication like anti-inflammatory drugs. Blood work is also essential to monitor the dog overall health if medication is used long term. I uploaded a video here that you can take a look at the canine left forelimb lameness and how to tell which front leg your dog is limping on. You may watch the video through the link provided. Treatment for osteoarthritis include the weight management, joint supplements like glucosamine and chondroitin, and physical therapy. Prescription diets such as the Hill JD or Royal Canine Mobility Support can help maintain joint health. In addition, therapies like hydrotherapy and physiotherapy can help dogs maintain mobility and reduce pain. For dogs with severe symptoms, monthly injection of medication like Adequan can provide relief. As a guide and recommend from the vet, if the supplements such as Ketofin and Adequan monthly to 3 monthly for vet visits, and a minimum of 6 month physical examination. If on pain medication, annual blood work is required, and joint radiograph for monitor progression of the arthritis is also recommended. The prognosis varies based on the severity of the conditions. If it's mild and managed early, it may be very good, but if severe or managed poorly, the prognosis may be poor. For your self-directed learning activity, you will design a preventive care plan for a young dog at risk of developing one of the conditions we discussed today. You can choose either obesity, cardiac disease, or osteoarthritis. Your plan should include recommendations for diet, exercise routine, and monitoring strategies, and should not be longer than 500 words. Be sure to submit your plan by week 17. To summarize, we have covered 3 key non-infectious diseases in dogs: obesity, cardiac disease, and osteoarthritis. This condition can severely impact a dog's quality of life, but with early diagnosis and proper management, many of these conditions can be controlled. As a veterinary professional like you in the future, it is crucial that we educate clients on preventive care and lifestyle management to ensure their pets lead a healthy and fulfilling life.